More evidence in recent weeks that the areas hardest hit by COVID-19 in the city are once again feeling its effects as part of the second wave. It's all based on data showing the percentage of COVID-19 tests that come back positive. Both medical experts and community service organizations say it's reason for alarm. No matter the number of COVID tests being done and the record number of cases that come with it, there's one other indicator that can show you just how bad this second wave is getting: percent positivity. Dr. Kashif Pirzada posted unreleased provincial data on Twitter Monday, backed up by separate numbers reported in the Toronto Star. And they show the city's northwest area is again being hard hit.
When it crosses 3%, that's when you need to start, shutting down things. But the data that we saw and then confirmed today showed in some areas it's 10 to 11%, which is extremely, extremely high. That means that there's a lot more people walking around with the virus than we thought was the case in the summer.
Toronto Public Health posts citywide percent positivity online, but it doesn't break it down any further. Despite repeated requests for more information, none was provided. Instead, this statement: while Toronto Public Health has been receiving preliminary data related to percent positivity by neighborhood, these data have not yet been validated and have not been included in public reporting.
There is without question greater impacts of COVID rates and infections on racialized communities, on lower income communities, and that is exactly what we are seeing now in the second wave.
Neighborhood support organizations like the Jane Finch Centre say they have no doubt those areas are still being hardest hit. Toronto's medical officer of health says it's also spreading as people move about.
Towards the late summer and throughout the month of September was that there was continued activity in those parts of the city that had been impacted earlier in the pandemic, but increasingly over time we saw infections appearing coming further south from the northwest end of the city.
As of September 20th, the city's overall percent positivity was at 2.5%. But indications are that is also on the rise and is likely exceeding the city's goal of keeping it below 3%.
I think that there's a possibility this could be more widespread, but it just means that everyone in the city and the surrounding areas needs to be on their guard.
To offer a comparison, there are parts of New York City like Brooklyn and Queens that have had that 3% positivity rate, and as a result, some things have started to shut down there. We do know that the city here has asked the province to step in and start shutting things down. Still at this point, nothing.